To order, Madam Clerk.
Commissioner Marecki.
Here.
Commissioner Baydoun.
Here.
Commissioner Anderson. Commissioner Colleen. Chair Baker McCormick.
Here.
You have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I have none. Next item.
C, approval of the June 13th, 2023 meeting minutes.
So moved.
It's been moved and supported. All those in favor, okay. Guess we can vote electronically. All right. And motion passed. Right. Okay, got it. Next item.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, forwarding notification of an emergency procurement report for Amendment 1 to a 180-day professional services contract with a 90-day option to renew with New Image Protective Services LLC.
Great. Good afternoon.
Good afternoon, Melissa Fernandez, Director of Juvenile Youth Services. This is our staffing company for the juvenile detention facility. And this amendment extends the terms and increases the maximum amount to September.
Okay, and so how's it going?
It's going. I can tell you that right now, with our staffing, our current staff census with regards to our direct care staff is at 107. Before the emergency, it was 64. And so we are getting staffing. We are in the process of rolling over those contractors to Wayne County staff. Of course, there's a process, how to make that happen. So we are continuing to staff to ratio. So we are off of our variance with the state and we are staffing to ratio.
Okay. And as far as the credentials, certifications, things of that nature that this contract and the contract employees, do they meet all of the qualifications and credentials do they have?
Yes, so all of the contractual staff are onboarded in accordance with our Department of Child Welfare licensing rules for new hiring.
Okay. And my understanding is the state is still involved in the emergency related issues that we're having with staffing and.
Yeah, so we continue to meet with them weekly. I think we've worked on our relationship and they have been very supportive of our decisions and what we're doing to increase staffing and just increase safety. So we do have some regular conversations with them and they continue to be monitoring our day-to-day in the facility.
Okay, and are there any current issues related to safety that are ongoing or that we should be aware of?
Any ongoing issues are open investigations. However, we have increased safety. The kids are out of their rooms, they're in school, they're in recreation. And so we are in a state of just normal day-to-day operations at this point.
And how many do we have juveniles?
We have 143.
143. All right. And the usual amount we would have in the past was like.
It was about 80, 60 to
yeah.
80.
Okay.
We have definitely seen an increase in admissions with the warm weather, which is typical.
Okay. All right. And how about the other outside vendors that we work with? Because we were relocating some to help with that.
So we do have some youth at our Macomb County Detention Facility and our Genesee County Detention Facility. We were using some of those beds to help with the overage. And we have had a lot of youth for residential services move to Spectrum since they do have beds for.
Okay. So how many were relocated? Because it seems like we still have the same amount.
We do. So at our lowest, we were at 105. And that was probably in April and May. And since then we've our numbers have come back up. Now, Oakland County and Macomb County have a limited number of beds that they share. And so we probably have about only six right now at out county detention facilities.
Okay, so the numbers, these are. And
Correct.
move some out and some more come in.
Yes.
and- Okay.
Yes, we still have about 50% of our population who are waiting for treatment beds in other facilities. We are in the process of working with Team Wellness to have our treatment program up and running so that we can address this issue and provide therapeutic services while they are with JDF. So that the jurist would possibly, consider that to be therapeutic intervention and release them, with heightened support in the community.
Okay, and then our contractor for their daily education, I know they were, I think, presented last month, I believe, or.
Capstone Academy, yes.
Capstone.
And summer school started today.
Okay,
Yes.
and how was that? Is that going well?
It is
in your eyes?
It is going well. We
Okay.
try to meet on a regular basis. We will be putting out an RFP soon for school services.
Okay. All right, Commissioner Marecki, you had a question? Oh, word, okay, sorry. Okay.
Oh,
Zero.
okay, I'm a little bit confused. This was a 90-day extension.
Correct.
Okay, so what are you gonna do after 90 days?
So we will, we are having that conversation now. We'll have to request another amendment, but we will be putting out an RFP.
Okay,
Yes,
all right, so you've had them just since December
correct,
of 2022.
correct.
All right, and just another quick question with Team Wellness. They have beds available, right, in their facilities? Or are you using them as like a helper back into society with these kids?
So they will be placed at JDF. So we took one of the vacant pods there and we've created a therapeutic environment so that they will have the therapist there providing group therapy, individual therapy, creative therapy, arts therapy with the kids. They will be connected to our jazz system and the courts so that they can appear in court and speak to their therapeutic process and progress.
Okay,
So they'll
and-
be embedded into our system.
Oh, okay.
Yes.
So how many, like most kids will go through?
No, so only the kids who've been adjudicated for level 2, which is secure placement, those kids that are sitting and languishing and waiting for. Now, as you know, when they sit with us, they could be sitting for a long time and that does not count as time served, unfortunately.
Hmm.
So this is our way to hopefully have that count as such so that they don't have to wait 2 years for a placement.
Oh, okay, got it. All right, I think that's it. Thank you.
Thank you, Commissioner Marecki. Vice Chair, Commissioner Colleen.
Thank you, Madam Chair. You gave us a number somewhere around 160. Is that inclusive of the kids that are at Macomb and other places too?
Yes, sir, our number is 144.
Okay, that's our total
Correct.
here or anywhere else. Okay. It is high. Yeah, I want to ask Commission Counsel, this is a receive and file item under the emergency procurement. Can we just go over the rules around the emergency procurements? That's a rather new category that we have. So I just want to make sure I understand the groundwork or what makes something emergency so that it makes it from here? What are the rules around that as a receive and file?
Okay, absolutely. Through the chair, Ebony Adams, Assistant Commission Counsel. So I'm pulling up, I actually have many code handy here. When we're looking at these emergencies, it should be just that. We shouldn't willy-nilly be having contracts or matters designated as such. So we're looking at contracts that would have delays that would jeopardize grants or funding, unforeseen or fleeting opportunities that may arise. In this case, we have a threat to public health, safety, and welfare. And that's what I would say that's why this contract came
Correct.
before us and is submitted as a receiving file. We know by the very nature of what's going on at GDF, we did have to have extra bodies, and I think that's why this contract came before us, and from what I can tell, it does seem suitable and appropriate.
We run into this in other areas of the procurement ordinance too. Like if you're gonna say it's sole source, you gotta submit a letter with a legal explanation about why that is, and our staff looks at, does the same process take place here? Have we received a letter from administration saying this is why it's an emergency? And our staff reviews it and says, yep, we agree with you. Is that how it works at our staff?
Through the chair, in this case, we did have the transmittal letter that provided some of that background detail to us.
Okay,
If there's something else that I'm missing, staff, please hop in, but I know in our review, we relied on the transmittal letter, and there were some other correspondence, email exchanges, memos, and other things that were attached.
okay. You know, the ground rules are important here. Now, this was originally a 180 day with one option for a 90 day. And the option there is taken here in our receiving file. For an emergency procurement, because it came up a minute ago, that if we have to extend this contract, under the rules, can they just come back and say, we want to do, we've done a second amendment? Or does it have to be a new one under emergency procurement? Once you've done the 180 and the 90 days, you're done, you have to do something different at this point, bring forth a new contract? Or can they say, no, the emergency is still going on and we're just amending the contract that we have? Again, without commission approval.
Commissioner, I think the importance here is that it be an emergency. So I would imagine it can be amended as long as the emergency exists. And that's an ongoing
Yeah.
determination that we will have to make as a commission.
So as the rules are written, Amendment 2 can just be added with a letter that says we're still in an emergency.
I would say technically yes, but we would have to scrutinize that.
Yeah,
with
I'd
the
like
commission.
to look at that too, because sometimes that can be a judgment call.
Absolutely.
And what is the definition of an emergency and how? So I just want to know the process going forward with these. I don't think I've seen an amendment taken like we are today with a receive and file. But then once that's done, the contract is done. So I'm just asking our staff, and I guess we won't answer it today, whether a contract like this, they can just add a second amendment and say, we still have an emergency.
Commissioner
Yeah.
Recky, to that
Just to
point.
that
Mhm.
point,
Mhm.
because the county deemed it an emergency, a health emergency, would that have qualified this to become part of it? I mean, we've had the jail stuff, emergency procurements, but the county actually deeming it an emergency, would that be part of this whole
Absolutely,
process
through the
too?
chair, absolutely. So we had the public health emergency. My understanding that sunsetted in June, however, but that, yes, that also plays a part, and state law authorizes that to be declared.
Yeah.
So we have kind of like the dual authority going on.
Thank you.
Yeah, and I think what we're looking at and what Commissioner Colleen is looking at is how many emergencies contracts are we going to provide to the same company without providing some type of remedy long-term, an RFP, if that's what we're going to do continuously, or are we going to just hire everyone? And I think you alluded to that as well, hire some of those folks to staff And at what point are we going to do that? If so, because we don't want this in another 90 days to have the same issue. So I guess what is the plan is the question.
Well, we are, as I said, we are in the process of working on our RFP.
Okay, so that's the plan. So this should not, I guess, there should not be another emergency
So we will,
contract.
we will need an amendment since this one is expiring in September. So we will need that because the RFP actually takes some time.
Right. Well, we need this one that's on the table. Is that what you're saying?
Yes,
Yes. So we know this one, that's what we're
correct.
debating or discussing. But after this one, what's next? And I think that's what Commissioner Colleen is saying, right? Are we going to keep continuously?
That's why I want to understand the rules.
Right.
And
Mhm.
when did the emergency order expire? My counsel seems to think it was a
In
few weeks
June.
ago.
Yeah, it was.
And here we are with an expired emergency,
Mhm.
taking an option. And the thing, these kinds of things are precedent setting, right? I understand how jammed up we are here. But there's other areas where I might not want this applied, where we just, well, it's an emergency. And so we got a 12-year contract with 2 5-year renewals onto it. You know, since we're setting a precedent, I want to understand, are we outside of the emergency, declared emergency, by accepting this option? What are we talking about? The First Amendment? Are we outside of the emergency where it wouldn't apply to taking this amendment? I think we need these things clarified, right, in government. This ain't our money we're spending. And with something like this, just like sole source contracting, what's the other one? They're about the only ones out there that can do it. So we're, there's some murky areas and always has been in our procurement ordinance. So what I'm looking for is clarification, maybe not here today, but I would love clarification from my legal staff. What are the boundaries here? What can be done? What can't be done? When the emergency's over, how did that affect it? Because this might be a novel situation here. We might not have had one of these emergency orders where the emergency expired, declared emergency expired, and now we're doing an amendment, taking the First Amendment to a contract that was let under. So just some clarification there so that we know the rule and everybody knows the rules. We don't need to get jammed up on rules, that we all agree this is how it's being done. And we all know what the rules are. I don't want to run into a situation where something would have to be backtracked that might be very vital because we don't have the rules that allow it. So I think I've made my point with counsel, and thank you, Madam Chair.
Thank you, Commissioner Colleen. How many employees are we are under contract with this?
We currently have 60.
60. At what are they all averaging the same pay rate?
They are. With the
Okay.
county's increase of 35% to a staff, we actually are a little bit above them.
Okay, and so what is the rate? Do you know?
I don't
what
know off the top of my head. I'd have to get you that range.
Hourly or, okay. Or is it a salary, is hourly? or
Hourly. For direct care staff, it is hourly.
Hourly, okay. Yeah, I would be interested in knowing what they're getting paid. That would be good. All right, any other questions? All right, we will take them all together. Next item.
Item 2, requesting commission approval of a 3/1/2020 National Criminal History Improvement Program grant agreement with the Michigan Department of State Police Grants and Community Services Division.
Good afternoon, Melissa Fernandez, Director of Juvenile and Youth Services. This is a grant that we received through Michigan State Police for a new live scan device for our juvenile detention facility. The one that we currently have is from 2010. It's outdated. It doesn't allow the capabilities that are required for data collection for MSP.
Right. All right, any questions, discussion? All right, next item.
Moving to the addenda, item 3. Requesting commission approval of a grant award with the U.S. Department of Health and Human Services, Health Resources and Services Administration to operate the county's 2 federally qualified health centers in the cities of Hamtramck and Wayne.
All right, good afternoon.
Good afternoon. My name is Khalif Morris. I am the FQHC Project Director / CEO.
Can you just talk about this contract or grant?
So this grant is year 12 of our annual FQHC Health Center Program grant from the federal government, HRSA, Health Resources and Services Administration, that allows us to operate our 2 FQHCs in Wayne and Hamtramck.
Okay. Any questions? Vice Chair Commissioner Khalil.
Thank you, Madam Chair. You're the new Tom Coaches?
No,
More or
I am the
less?
new Jennifer Caruso.
Oh, okay. What county money goes into these FQHCs?
So my salary,
Yeah, we provide a little staffing, right?
just my salary, and we have some assistance from MMB, Corp Council on the HSVS side.
For staff but for the day-to-day operations, this grant and the dollars that come in through operations
Correct.
keep these going on Madam Chair, I think it's time that we have these folks come give a little update. These 2 FQHCs. My feeling is, but I haven't seen this, is we're making an enormous impact in both of these communities in who we're reaching and how we're reaching out to. There's a lot of discussion that's been going on for a long time, how we deliver healthcare in underserved communities. This is what these 2 operations are doing, and understand a little bit better because they do operate independently. They have their own community boards that make decisions.
We have 1 community board, but we are 1 FQHC with 2 sites.
With 2 sites, that's what, so I think it'd be a great learning experience and because they are kind of sponsored and we by the county and we do provide some staffing, staff positions to keep it running. I would like to see us get them over here
Coordinated.
sometime and just get a
Yes.
report who they're serving, how many people they're serving, what kind of services,
Mhm.
I think it'd be very valuable because these FQHCs are the front line for so many people. So
I
thank you,
agree.
Madam Chair.
So our staff clerk will be in contact to arrange that.
Awesome. Thank you very
Thank you.
much.
Thank you. Any other discussion? All right. All right. Thank you.
Thank you.
Next item, please.
Item 4, requesting commission approval of a cooperative operational agreement with Wayne County Healthy Communities to create a co-applicant community health center board for the operation of the county's 2 federally qualified centers in the city of Wayne and Hamtramck.
All right.
Good afternoon, Khalif Morse again. So this is the HRSA mandated co-applicant agreement between Wayne County's Health Department and the Board of Wayne County Healthy Communities to operate under this grant.
Okay. And this is to create a co-applicant board. What would that, is there first, parties to a board already, or there's no official board in place? I'm
So the board is in place. The
Okay.
board has been in place since it started 12 years ago,
Okay,
but the agreement expired May 30th. And so
Okay.
this is to reconstitute that agreement.
I see. All right. Any Vice Chair Colleen?
Thank you.
Mhm.
And that's a federal mandate.
Yes,
Every 10 years, you gotta,
every 5 to 10 years, you have to
5 to
renew your
10
agreement.
years, yeah, on the board. FQHCs in general in our neck of the woods in Wayne County. My understanding, my background is that we're way underserved in this county for federally qualified health centers. That towns like Cleveland, Chicago have many more FQHCs than we. Is there any thought given to more FQHCs that the county would help sponsor and get going? Is there any thought down the road of that?
So there's a number. So Abdul Al Sayed, Director HHVS. There's a number of different ways that an FQHC can be built. Your comparison was Cleveland. It's actually quite rare for there to be a government sponsored FQHC. Traditionally, they tend to be nonprofit
Right, yeah.
sponsored.
Right, they're private.
Yeah.
I didn't mean to imply that they're private.
So the goal of building out more healthcare access, which is FQHC is one means to doing that, I think is certainly shared. The question of creating space for that to happen, I think there is, of course, the approach that we've taken about 10 years ago and we're actively working on right now. But there's also work to be done working through other organizations that do hold FQHCs, Authority Health, for example, being one of them,
Yeah.
to expand those footprints. But, from where we sit, we're consistently looking at new opportunities to provide better access to healthcare. This is one model of several, and the hope is that we'll be coming back to you with some perspectives on how to do that in the near future.
Full disclosure, Madam Chair, I chair the board over at Authority Health that was referenced, and we're in the middle of making our application and getting our act together to open another FQHC. But I've been involved in this issue ever since I've been on the commission, and I know, yeah, it's not governmental. And I don't know if the county has a role here too, because one of the things the feds have told us in the past is that there's too many people that want to operate one of these, but they compete with the others, right? And so you get 5, 7 applications from Wayne County, but they're overlapping. And the feds say to Wayne, hey, guys, one proposal, figure out your territory. We're not going to approve new FQHCs when you guys are fighting over turf. Have a plan for Wayne County. Are we kind of work? I mean, our numbers, we keep saying, our numbers are god awful in this county for health. Are we convening any kind of a roundtable or to have more of a strategy so we can get some federal dollars here and get more healthcare right where people live?
Yeah, I think that's a really good thought, and certainly something that we'll take back and think through.
Okay, yeah, it can't come soon enough. So I just wanted to raise that issue today as long as it's before us. Thank you, Madam Chair.
Commissioner Marecki?
Thank you, Madam Chair. I'm wondering who serves on this committee, not specifics, but what constitutes the committee members?
So the federal requirement is that 51% of the board must be patients of the health center who received a direct care service in the past 24 months.
Okay, and what's the other 49%?
Made up of experts in various healthcare fields, law enforcement. There's a wide variety. And so currently we have 9 members. And so 5 of those 9 are patients of the health center.
Okay, the other ones are varied occupations.
Yes.
All right, thank you.
Thank you, Commissioner Anderson.
Just wanted to say, I think it's a really a great goal to be able to open additional ones, or at least make sure that people are served in other parts of the county. I know downriver, I think there's a real issue downriver, and we're lucky that the Inkster facility, or the Wayne facility rather, is there. And I know the underserved and Inkster and surrounding communities has that facility. That's a very nice facility. And I think we support that one also. I believe the county does of the federal.
The only two that we currently operate are the Hamtramck facility and the Wayne facility, although there are FQHCs in that area. And, you know, and I think that they offer this similar service to what we would offer in our facilities.
Right, yeah. One of your predecessors, Dr. Amami, was out there and we had a grand opening out there a number of years back. And that facility has done exceptionally well, the one in Inkster. But it's I think it's not the same certainly as this, but it provides the health care to people that really need the health care that can't afford it. But anyway, that's all. I support the idea of expanding. Thanks. Thank you, Madam Chair.
The 9-member board, you said the members 51% were community. Do they have to be in the community in which that FQHC is located, or is it, where do they come from?
So they must be patients of the health center.
Okay.
And so the health center has specific zip codes of what we serve in terms of population. And so if they live in those zip codes, they're considered a patient and they're eligible for board membership.
Okay, and then the commission gets to appoint members to that? No? Okay. So who gets, yeah, where do the other members come from, the experts?
So they apply and have to go through a rigorous process through nominations committee to meet various areas that HRSA outlines in the manual. They have to be experts in social services, behavioral health, primary medical care, dental services, OBGYN, community development, economic development, law, various areas of expertise. And it depends on how many people are on the board and what they have currently. They will pick members to augment their service availability.
Okay, and of the community members, are there any other requirement other than being a patient? I mean, is it, you know, are you looking for a certain type of board member other than a patient?
At the moment, no, because board members go through rigorous training. They get background information to find out how to be a board member, because it's not the same as being a corporate board member. You have to follow the federal guidelines. And so they all get training on how to do that.
All right, any other questions? All right, if there are none, we'll take a motion to receive and file item 1 and move approval for 2, 3, and 4. And all right, it's been moved, but it's a motion. I don't know. I can't. So it's been moved by Anderson and supported by Commissioner Marecki. Okay, and then we can vote. All right. I think.
And then 2 minutes later, it goes off.
All right, motion passed. Next item.
F, such other matters as may be properly submitted before the committee.
There are none.
Public comments.
There any public comments? Anyone in the audience? Anyone on Zoom? On the phone? Public comments? Any emails?
There are no emails.
All right, next item.
Adjournment.